Hi everyone, welcome back to our Majors in Focus series. My name is Jade Smollett and I'm a student here at the regional campuses. I am here with Dr. Brooke Flinders and Dr. Suzanne Strickland, and we're going to be exploring our RN to BSN major. I'm going to have them introduce themselves and tell you a little bit about themselves.
Hi, my name is Brooke Flinders and I'm Chair and Associate Professor of the Nursing Program at Miami.
And I'm Suzanne Strickland and I'm the coordinator of the RN-BSN program here at Miami.
Great. Can you just give us a brief overview of what the RN to BSN program looks like?
Sure. So we have two options at Miami University for nursing. And the first is the traditional 4-year program. So that's for somebody who is not already a nurse. The other option is the RN to BSN completion program. And in that program, it's for somebody who's already a practicing registered nurse, and they are able to get their bachelor's degree in nursing in 2 years.
Great. So how long does this program take to complete?
That's a good question. A lot of students ask that. That really depends a lot on how long the student has been in school previously, how many credits they transfer in. We have had students graduate in 1 year. The average student takes 3 to 5 years to complete the program.
Okay. So how long are the courses and how are they structured?
Okay, so the nursing courses are structured a little bit differently than some of the other general education courses here at Miami. The nursing courses in the RN to BSN program are on what we call a sprint, which means that they run over 6 to 7 weeks. So you can get 3 or 6 or 9 credit hours over a 6 to 7 week session. And so that is the way that the nursing courses run. The general education and science courses generally run over the whole semester, but some of them also run on a sprint calendar. So it depends on which courses you're taking when, and I help students look at the calendar and see what works for them and to identify when the courses are actually being offered each semester.
Okay. So is this major entirely online?
Yes, it is. All of the nursing courses and the general education courses that students need are all online.
Okay.
One other thing that I think would be important for students to understand is that there are several campuses here in the Butler County area of Ohio, and that they are welcome at the campuses and also to take non-nursing courses on the campuses if they so choose. So if they need a science course or if they need an English course or a sociology course, they are welcome to take those on campus if they choose rather than online. All of them are offered online, but some students like that flexibility of being able to take a course in person if they choose.
If I was a student and I was really nervous to take online courses, how would you kind of explain those courses to me?
Okay. That is something that is common with people who come in and have not had online courses. We have more and more students who have taken at least one course online in the past, but many still have not. I encourage the students to structure their time so that they know when they are studying, when they're when they're working, when they have other things going on in their lives, and that helps them to understand that they need to get work done each week, that there are different things assigned and that it needs to be turned in, and it helps them identify what they're going to do when and keep on schedule. That's the main thing with an online course, especially when it's run over a 6 or 7 week session, is that they run very quickly and you need to stay up and you need to make sure that you're not falling behind. So that is the biggest thing as far as that goes.
I know for myself as a student, me taking online courses, it's a lot more self-organization than anything else. So since this is an entirely online program, are there any campus visits that are required?
There are no campus visits that are required. Students do come to campus sometimes. Some who live in the area, some who live out of the area, they just choose to come in and meet us and see what the campus is like and meet some of the other professors that they have in class. But that is not required for anyone in the program.
Okay. So since this program is online as well, are there any clinicals that you have to attend?
No, we have reorganized the program with student feedback and with our accreditation bodies in mind. And now many of the courses have project-based assignments that are replacing the traditional clinical assignments that were in the past.
So if I needed to take my exam, Do I have to drive to a testing center to pay for those exams?
You don't. We typically don't have a lot of tests that you would take, but we have no required tests that you have to drive to a testing center for. There's no proctoring for a test like that.
Okay. So if I wanted to apply for this program, are there any specific requirements that I need to meet?
The first is that you need to be a registered nurse. Again, this is a completion program for practicing nurses typically. So you need to have an associate's degree in nursing. Besides that, really, it's a matter of, you can get started with a few of our courses before you've been accepted. So you should contact our office if you're interested, and we can talk about your specifics.
Cool. So what if I had more questions and I wanted to meet with someone in person? Would I be allowed to come to campus and meet with someone?
Sure, you'd be allowed to come. We can meet online, we can meet virtually, we can meet email, we can meet, in person, anything that works for you. Yes.
Okay,
Mhm.
great. So what will having my BSN do for me in my career?
I think for one thing, a lot of employers are requiring a bachelor's in nursing now. So often when you graduate with an associate's degree, employers around here will require you to finish up in 3 years, 5 years, it just depends on where you work. So for one thing, it will let you keep your job in those situations. Besides that, I think that a lot of people use the bachelor's degree in nursing as a building block or a stepping stone for moving on to a master's degree. So once you've got a bachelor's degree in nursing, you can specialize, and typically a master's is in 2 years. And that's where you see people, doing all sorts of different things that make them more autonomous in practice. You can be a nurse practitioner, you can do all sorts of different things at the master's level, and then the doctorate level beyond that.
Yes, one of the main things that our students are doing also, besides getting them to keep the job that they have, is because there is another job where they are that they would like to have that requires the bachelor's degree. So sometimes they can stay in the position where they are without it, but for the position that they want, they need that bachelor's degree. So some of them are doing it to keep their position, and others to move into another position where they are.
Okay, great. That makes a lot of sense. So if after watching this video I still have a ton of questions, who should I contact?
Okay, there are several people that you can contact. One would be myself, and the other one would be Lauren Hickman, who is director of the online program recruitment. And so her information and mine should both be available on this video after it ends.
So why would I choose Miami Regionals for my RN to BSN?
I think that most people choose Miami for the RN-BSN program because of our reputation at Miami, because you get a high quality education at an affordable price. Students also enjoy flexibility, and the 7-week sprints allow us to have a lot of flexibility. As Suzanne said, students can get through our program in 1 year if they are able to take that many classes at a time, or they can spread it out if that's better for them.
Dr. Flinders and Dr. Strickland, thanks so much for meeting with me and helping me understand this major more, and helping a lot of other people understand this major more.
You're welcome.
Thank you.
Yeah.